Dengue fever is the fever that is caused by the transmission of the dengue virus by the bite of a mosquito. This is Aedes mosquito, that is a daytime mosquito. When it bites the human being, it transmits the virus into the human body, causing the dengue fever. There are various symptoms of the dengue fever. One, you may have very mild symptoms in the form of simply fever, body aches, joint pains, nausea, vomiting, or you may have the severe symptoms in the form of recurrent vomiting, loose motions, fall of the blood pressure, fluid accumulation in the cavity in the form of distension of the abdomen, fluid accumulation in the lung causing breathlessness, swelling in the limbs, decrease in the urine, severe jaundice. These may be the various symptoms of the dengue fever. Dengue fever is usually diagnosed both by the clinical history and laboratory examination. The clinical history, when the patient presents, especially in the endemic zone like ours, with history of high-grade fever that is continuous, unremitting, and associated with severe body ache, sometimes rashes, purpuric small pin dot, hemorrhagic spots in your lower limb, over the bodies, without many times itching, then you suspect the dengue fever. And laboratory investigations are like you do a peripheral smear to see what are the platelet count, you do the complete blood count to see the total leukocyte count and platelet count, you see the hematocrit, that is the thickness of the blood you measure, and then you do the dengue serological test. These serological tests can be simply antigen test that we do for the NS1, it can be the antibody, or you can do the PCR for the dengue virus RNA. Treatment process is mainly symptomatic. If you have got mild dengue fever in the form of only fever, congestion, throat congestion, body ache, paracetamol, plenty of fluids and rest. But in case the patient is presenting with dehydration, recurrent vomiting, breathlessness, swelling of the limb, then of course he is required to be hospitalized. And once hospitalized, then it is seen whether he is having dengue hemorrhagic fever only, he is going through a dengue shock syndrome, and that treatment is modified accordingly. The patient usually requires symptomatic treatment in the form of IV fluids, paracetamol injections, any antacids, and in case his platelets are very low, then like less than 20 or 10,000, then only you transfuse the platelet, and otherwise you just keep a symptomatic treatment. Dengue prevention is, you see, right now we do not have anything except for our lifestyle modification. We should wear full sleeves, especially in the seasons when the dengue is an epidemic. We should avoid going to parks. We should avoid clogging of the water in either drains, pots, water coolers, etc. That means we should not allow the insect to breed. If we can only prevent by preventing the breeding of the insects such that they do not bite. This is one. Another prevention, of course, the dengue vaccine is in the pipeline. It has been under research for several years now. Now, latest being the one vaccine, that is mRNA based vaccine, that is same technology that we used for the COVID-19 vaccine, is being used as trial, and in USA this vaccine known as dengue vax is being used especially in the patients who had dengue fever, seropositive only. Because of some technical reasons like antibody mediated sensitivity reaction enhancement, this is not being used in endemic zone like ours in India, where there are many people who are susceptible and who are not seropositive. That means they did not have any infection earlier.